Thank you for sharing this lunchtime with me. Today we will be talking about traumatic experiences, but there is no traumatic scene or there is no traumatic musical thing inside the presentation, because sometimes people say, do you have those pictures? I'm the one probably in the field, when I'm working in the field, I say no pictures and nothing else that's traumatic can be passed from hand to hand. Like in the latest events of the Ankara bombings, after the bombings, there was a kind of problem with the issue, because a lot of people, before the TV people or the news people came in, they start taking pictures. And those pictures that are taken probably are contributing to what we call the post-traumatic stress syndrome. And here, the reason I like to give this lecture, because most of the time we talk about the traumatic experiences, but nobody talks about how to cope with the traumatic experiences or what happens after the traumatic experiences. I hope I am doing this. These are, when everybody says you're the expert on traumatic experiences, it sounds good at times, but sometimes it's very sad that I am the expert in the traumatic experiences. It always reminds me that I was the keynote speaker, the opening speaker in one international meeting in 2013. And they wanted me to do the opening session. I said, why me? Because they said, you're the expert. So it felt good for a minute, but then after I had the talk, and everybody was like watching and saying, Nedret, you're so experienced. It felt a little sad that I had to be experienced in such a traumatic experiences. When you look at the background, probably until 1999, there were other traumatic experiences, but as psychologists, probably we were not much involved, at least not in a big scale. In 1999 earthquake, I'd like to share that because I wanted to go to the field. And I asked the health department here, I said, can I go? They said, no, because you're not a doctor. I asked Metu, because I was teaching there, I said, can I go with you? They said, no, because you're not a doctor, you cannot be in the team. And UNICEF called me up and said, would you come with us to assess the situation and let us know what can be done? So it was the first time that I had seen the earthquake area like 1 week after. And then it was enormous sadness. Then I decided that we had to do something to overcome. And I joined the team of UNICEF and Ministry of Education. Why? Because I figured we started getting the tents there and getting the psychologists who are volunteering in the field, but I figured it's not going to work with this volunteer work. It has to be some way, more systematic way that we could help the survivors. So that's how I started, and I ended up traveling to the area every week for 2 days. We started something called psychosocial. I got lots of, criticism from my colleagues saying, you're a psychologist, you're a clinical psychologist, you should be sitting in your office and treating people. As a clinical psychologist, I believe that not everybody who has a traumatic experience or bad experience is going to fall apart. Because I believe that every single person has a psychological strength inside, and they are able to survive. So the reason I go there is not to offer them a package, but usually to see which kind of strength they have and what can I do to kind of bring that up so that they can survive and they can cope on their own. So I worked in the area for 5 years, and we kind of developed this national program, which is used now in the schools. It's called the psychosocial support system. And once we started, then you can see that those years, the earthquakes were really common. And I worked in Iran earthquake, and as well as in Pakistan earthquake, and Turkish earthquakes. And there was the massacre in Mardin, maybe you don't remember, but 44 people were killed during a wedding ceremony. And everybody said, earthquake is different. What are you going to do with these people? I said, I don't know. But I have to give some kind of support to people who survived this killing. So I worked there. I was the head of the psychosocial team. And then Zonguldak was my first mine explosion. I had never been in a mine before. But I was there again with the psychosocial team, and we were trying to see how we could help the survivors and their families. And then I was thinking, this is the first and last time in the mine accident. Then happens again in Soma, 2014. I went there, I was there for 2 weeks. I kind of, again, arranged the trainings as well as the psychosocial interventions. And I kept thinking, probably there's not going to be another mine accident in this country, because it was a big one. We all talked about it, and all the organization was being done. But again, Ermenek showed up. So when we look at it, it's like when we said in that big opening that Turkey is kind of the country where we have traumatic experiences very often. So we should be ready. That's how I say. The Syrian camp, besides my work in Bilkent, I worked with the UNHCR for the past 10 years. Everybody thinks that the refugees in this country started coming in 2011. No, we have had them for years, and we have been working with them for years. And we set up the first Syrian camp and the psychosocial services to be offered there. I was there for a week. I came back. We had the team ready, psychologists, social workers, everybody was there. And I got a phone call. They said, Nedret, there's a big problem. I said, what? I was thinking maybe, the Syrian people came and there's big problems. They are fighting. I said, what is it? The guy who called me up, that was social worker, said, we set up the camp for 100 people. I said, yeah. And 150 showed up. So we were kind of shocked what we are going to do. Now we have almost 5 million living in the country. And of course, we are doing other things. The purpose of the lecture or this talk is more like to let you know what the traumatic experiences are. It could be a personal, or it could be a big community event. Which kind of effects probably you will see in yourself and others. And you will also figure out which one is normal and when you should really look for help. When we talk about the traumatic experience, it's extremely dangerous. It is sudden, something that the person or the community cannot control. And the idea that the idea of death might be there. Like when we look at it, it's like in the latest bombings, a lot of people are more traumatized, even though they survived, they weren't even there. But when the person starts thinking, I was in Kızılay 10 minutes ago, I could have been dead now. It's still traumatic. Even though the person survives, we call it a traumatic experience. So these are the traumatic experiences. It's not only bombings, but all this list is like the traffic accidents. As you know, we are #1 in the whole world in the number of traffic accidents. Armed conflicts, natural disaster, rape, terrorist events, wars, earthquakes, death of a fellow worker or friend, or somebody commits suicide in the family, is going to be called what we call the traumatic experience. And these are the effects on the traumatic experiences. This is really, this is what we looked at it when the event happened in terms of the incident, how the community is ready or not, or the person has the experience before or not. But the only thing I can say from here, if you have had the experience before, like when in terms of the bombings, we have had 3 bombings. It depends on how you perceive it. If you have coped with it, the first one, the second one is not going to affect that much. But if you have fallen apart and saying, oh my God, what's going to happen? I cannot cope with this. The second experience is going to be really more difficult. But these are the ones that affects people in terms of the traumatic experience. The physical distance is probably important. Because if the bombings happened in Mardin, we are not affected that much. Or bombings happen in the train station area. For some people who got there, together there, we can say, you know, well, that's a different issue. Or it happens with the military bus service, we are still away from it. But when it happens in Kızılay, where everybody, regular people are hanging around, it's going to affect more. So it's physical distance is important, psychological distance is important. That's why the bombing in Kızılay is going to affect everybody longer. Among all, what I can say is the social support system seems to be the most important in terms of coping. Because when I was preparing this talk, I checked out again the Twin Towers. It was 2001. And up to that point, all the research was showing that some personal characteristics, whatever was helping in terms of coping. But after this 2001 bombing of these Twin Towers, all the research shows that the most effective way of coping is the social support system. So when they asked me in the opening talk, they said, what is so much about the Turkish population or people who live in this country that they are so resistant? I said, it must be the social support system, because we always support each other. But when we look at the effects on individual, it's like a lot of loss we are talking about. These are the symptoms that we see most of the time in people after the traumatic experience. Depressions, helplessness, anxiety, not being able to be interested in daily activities. People do not want to get up. I have heard a lot of students in this university and in METÜ, in Ankara University, did not want to even come to the class. They were afraid of being bombed. And even if they were not afraid of being bombed, they did not feel like getting up and going to the class or doing the readings. Then there's the change in the sleep and eating patterns, and we have this couple students never left their dormitory. They never even left their room. They were in bed 24 hours. The friends were concerned, and some of them called me up and they said, what are we going to do? The thing is that if there is a loss, of course, it's even more difficult. And what we also see that difficulty in concentrating, because as instructors, as teachers, we expect the students concentrate and understand the question, answer the questions, but it's more difficult. It's also a coincidence that I had 2 exams, and both of them I make 3 exams every semester. 2 of my exams were just after the bombing. So there was a bombing, and the next day I had the exam. So I canceled, we had talk, and then I did the exam some other day. In the second bombing, I had the exam on Monday again. So I just went into my class and I said, I'm having the exam. But then I realized that my best students could not, even though they sat there, they answered the question, they were not able to concentrate. So we are giving makeup for the exam again. So it's very difficult. Also, after the event, some people might feel, even though they were present at the bombing site, they felt like it didn't happen. It was a dream that they were going to wake up. So it's one of the normal things after the traumatic experience. The way we describe is that we do have some traumatic experiences every day, but when it happens in a really overwhelming way, what happens? This is what we are talking about. This is called the PTSD syndrome. That's the post-traumatic stress disorder. And if we see these symptoms in a person in a regular life, we say PTSD, and usually there's the drug treatment and the psychotherapy treatment. But these symptoms are kind of normal if they happen right after the traumatic experience, and they probably will decrease by time. I just want to go back. These are the ones that are normal for a month or so. So if anybody comes after the bombings and having these experiences, we say it's normal, but if it lasts more than a month, then we will have to think about other reactions. These are the psychological reactions in children, which we see most of the time after the traumatic experiences. And the kids will usually act like younger than their age. A 12-year-old, 10-year-old will be kind of clinging to the family members, will not want to go to school, will not want to go out and play. There will be nightmares and sleep problems, and anxiety about living and going to school and doing other activities. But the most noticeable one is the one that the kids usually play the same scenes that they have witnessed. For example, when we worked in Mardin, before we arrived, somebody collected all the toys that were like in shape of guns and other issues. So there were no guns in terms of toys. But what happened, the kids made guns themselves from the wooden sticks. And guess what they did? They killed each other in a play. Why do you think they are doing it? Why do you think the kids are kind of repeating the scene that they have seen earlier? Any idea? Yes?
They want to make sense of it.
Yes, because what they have seen has no sense. And they are trying to make sense out of the experience, so they repeat what happened. So with the kids who are at an earlier age, like 4 or 5, this is how we usually figure out that something happened to the kid. Because the kids are not able to share their experiences like adults do. They can sit down on the chair and say, well, I was abused and whatever. But if you look at their plays, you can usually see the signs of abuse from their play. They cannot lie in that term. Young people, usually there will be immobility, like they don't want to go anywhere, they don't want to do anything, difficulty in concentration, mood changes, hopelessness, suicide attempts are very common at this time because they don't know how to deal with the effects of the events. And risk-taking behaviors, substance abuse, drinking will increase this time. And the other thing that sometimes there will be hallucinations, like I see something or I feel something. Usually as psychologists, we are worried about the hallucinations or delusions because that's a problematic area. But if it happens after the traumatic experience, it's normal. So when we look at all these symptoms, we say if it happens after a traumatic experience, no matter how abnormal they look, there are normal reactions. It's the event that it's abnormal. That's one of the problems that when I work in the field, I do have problems with the psychiatrists. Usually we work as a team, psychiatrists, social workers, psychologists, and sometimes educators and teachers. So I remember Soma, the first it happened, like in 2 hours or 1 hour, I was on the way. I did fly into the area and then drove to the mine area. And we had the team of people from the Ministry of Health. And we had psychologists and social workers. We are trying to figure out which kind of psychosocial intervention we will be planning in the area. And we still have people being taken out from the mine, dead or alive, or that kind. And the person, Müsteşar, I can't figure out what's the Turkish word, but he's the highest guy in the area, is having a meeting with us and saying, okay, what do we need? All right, let's visit every single family and give them medication. I said, what? What kind of medication? Antidepressant. I said, antidepressant? For what? Because they are, depressed. Wouldn't you be depressed if someone is there, stuck, dead? I said, it's normal that they are depressed, so we are not going to give medication. But they got upset. They said, no, everybody is so sad now. They are doing harm themselves or whatever, so we have to give antidepressant. And it's like saying, we need so much of antidepressant. So I got so mad. I said, and I was saying, no, that's psychosocial is not giving medication to everyone, when somebody dies in the family, because you are preventing their reactions. When you prevent the reactions, those reactions will show up a month later. So it's even worse. So I said, no, that's not psychosocial. We have to do other things. But finally, I gave up. I said, don't you think the Minister of Health has some helicopters? They said, of course we do. I said, why don't you just fill it up with the antidepressant and spray down to 8, areas? Because when you look at the population who are affected, it included 8 provinces. So how can you visit every single house and prescribe antidepressant? So they hate me as a reaction. So when I show up in the fields, the psychiatrists usually will disappear. I just want to go over quickly about the psychological reactions after disasters, because these do have some timing. That's why we do not want to have any intervention during this time. Like the first 2 days, it's a psychological shock period. You can't give antidepressant at that time. The person will look like they are out of their minds, but still we don't give them antidepressant. These are the problems in the first 24 hours or 48 hours. Irrational thinking, memory problems, not feeling the pain, freezing reaction, because this is a normal reaction to a really extraordinary event. I always explain it this way. Let's say you're living in early ages. You're getting out of your cave, trying to look for some food, and you suddenly meet with the big, big monster. Your body has to react without your control. So it's like, it's the fight or flight reaction is very normal. Usually after this kind of events, you will see people, small people like me, carrying heavy loads that they cannot carry in regular times, or doing other things to help other people. But what happens is that there's a third reaction, that's the freezing reaction that we do not talk about. After the bombings or after the earthquake, some people with this shock, they were frozen completely, they couldn't move. There was a young lady who kept saying to me, I killed my child, I killed my child. I said, what? How can you kill your child? When the big earthquake hit, it was the middle of the night. And she was alone, her husband was working. She was in the bed, the baby was in her bed. So with the movement of the earthquake, 2 beds separated and the baby died because of the falling wall. And she kept saying, everybody saved so many lives and I couldn't even save my own child. After the bombing accident in Ankara, a lot of people helped each other. They were able to run away, but some of them were completely frozen and couldn't move. The other thing is that also they thought it was not happening really. It was a movie. Most of the time it's the reaction, like the first 2 hours, we think it's not real. It's just a movie, it's a part of the movie, or it's not real. After that, the emotional part, anxiety reactions will show up. Like this will last from 2 days to a week, and there will be avoidance from everything that reminds us the event. So most of us didn't go to Kızılay, right? Because we were afraid that there will be problems, and everything reminded us the bombing. And there will be flashbacks from the event that we have lived through, and people usually think that they are going crazy. This is the time where people will increase the intake of alcohol or other drugs, just to calm down the reactions. And the third period is when you hit the reality, like, yes, this is not a movie. It happened. It happened in Kızılay, and a lot of people died. And there's the depression period, and people want to be alone. They don't want to talk to anyone. They are in grief period. And then there will be times will come, and we will all go back to our regular routines, and then they will try to do their daily activities. But it doesn't mean that we forget everything that happened or people who died. It's part of our kind of memory. And usually these are the effects on the families, because the way I look at it, the people in the family, they might have different coping style. Usually women will cry and will be talking to each other, and they will be needing each other, and they will need the social support. And men are usually not, kind of expressing their feelings. They want to keep inside, and they want to look strong. They don't want to talk. They kind of pull away from other people. So there goes the family conflict. And usually there are problems if they have to move to somewhere else. The kids will have problems and everything else. The community will be also affected if it's a large-scale disaster. They will be changing the places. They will have no jobs when they go, and there will be other problems. And these are, of course, the families will separate, and everybody will be going somewhere else. When I do plan the psychosocial interventions, I usually ask people not to leave the place that they have lived all their lives. Because what happens is that, I remember the case when we worked in the earthquake area. One of the teachers said, I'm going to move away from here. I'm not going to work with you because I have a son and my husband died. I want to move away from this place. And I said, where are you going? She said, Aydın. I said, Aydın, it's the first-degree earthquake area. And I said, does your child want to go? She said, I don't care. We have to go away from here. And next day she comes back and she said, my child doesn't want to go. Why do you think the child does not want to leave the place? Any idea? What? Comfort of familiarity. He said, he was like 7-year-old. He said, I lost most of my friends, but the ones who survived are here, and I have to be here with them. And when we go someplace, they will not understand what we went through. So the same thing happened after one earthquake, the government decided to offer some of the families to move somewhere else temporarily for a couple of months. I said, why? Because they can feel better. They moved them to Alanya, to Izmir. I said, are you crazy? You can't do this. No, we want them to feel better because when they come back, they will be in a better way. What happened? They moved away. When they went to these places, some of them were in Ankara, we talked to them, they didn't feel better. They said, here, everybody seems to be so far away from what we have to go through. They don't understand what our feelings. And when they went back, they again had to go through all the reactions. So it's better to keep the people in the same place and help them there. Quickly, these are the stages that we go through, because I see these stages all the time afterwards. Right after it happens, we are all panicking. What is happening? Are we safe? Something bad is going to happen. There's the problem. There's no future in this country. We have to go somewhere else. And then we have the rescue and heroism stage. Everybody comes in to help. In Soma, it was interesting. People were sending trucks load of blankets. I said, blankets? What am I going to do with the blankets? Yeah, it happens when earthquake hits one. Yes, you need blankets. But here, everybody has their own houses. There's no need for blankets. But people do want to help. So they bring everything. And some of them will come, like I had to send away one bus full of social workers who come from Izmir. They all came, like 40 people showed up. I said, and Kızılay always puts me in charge. They said, Hocam, you talk to them. So I talked to this young man, he said, I brought 40 young person from Izmir. I said, who are you guys? Social workers. What are you going to do? We are going to help you. Do you have a place to stay? No. And we don't have a place to stay for 40 people, no food, nothing. It's not the earthquake area. We didn't set up tents. There's no kitchen. I said, do you still have the driver with you? He said, yes, he's about to take off, go back to Izmir. I said, get on the bus and go back. When we need you, we will let you know. Because this is the stage everybody wants to help, but it's, you know, you have to figure out which kind of need do we help. I hate when people take pictures when we do this kind of work, so I always say no pictures, no pictures, no pictures, because those pictures not only make people more traumatized, but also people who are not there also are traumatized. So I prefer that people do not take pictures, only this one, because this was like part of the support each other and then saving activities. And I usually am the one who has to fight with everybody in the area. In one earthquake, what happened was a psychologist from the hospital called me up and said, Hocam, get here quickly. They are taking pictures of people who are, you know, coming in. So I go there, and there was the guy from Reuters agency. He was, because the Turks disappeared until I got there, when they heard I was coming. Turkish journalists disappeared. The guy was there and saying, I'm going to show the whole world about what happened here. I said, nope, you can't do that. He said, why not? I'm from Reuters. I'm very experienced. I have been working in the field for 5 years. I said, cut it out. I have been working in the area for 15 years. You can't take pictures. This is Turkey. No pictures. He said, you're preventing me from doing the service. I said, you're not doing service. You're creating more trauma. He said, I do have the permission from the head of the hospital. I said, who's this guy? So they showed me someone. So I go over there. I said, look, you should stop people taking pictures. He said, why? And there was a woman who was just being taken out from the rubbles. She was half naked, unconscious, and were ripped everywhere. I said, what if this woman was your wife? And somebody took pictures, and it's all over the world. How would you like that? What if she survives and sees all these pictures? So that minute, they stopped taking pictures. That's why we don't want the pictures. What happens after that? We share as a community, we support. That's unconditional support, but the support gets less and less, and then sadness will start. Then we will survive and we will have new life. In short, what we call that, if as a personal community, if we perceive the event is uncontrollable and I cannot handle this, it becomes impossible, the recovery is more difficult. But if it's a challenge for new empowerment, then it's the recovery. This is from one pictures. This is what we do usually. I'm going to go fast. My question would be, what do you do when you don't feel good? I know my time is getting less and less, but how do you cope when something terrible happens in your life? It doesn't have to be this kind of terrible things. What's your coping style? Yes? What?
I try to perceive the event as being not that terrible.
Not that terrible. So it's like you try to do the evaluation again. Okay. That's nice. All right.
I try to find one piece of news about somebody who's had some experience that was 10 times worse than mine.
So it's kind of similar tactic, right? So it's more of with the example. That's nice. Anything?
I do nothing.
You do nothing. What's that mean? You sleep? You do?
Yes, basically I'm making less my personal affection and my daily routines, and I just going to avoid and do nothing.
Does it help?
I think it helps.
Okay. All right. Anything?
Talk to my wife, talk to friends, talk to people in my circle.
Okay. Yeah.
Before I have pain.
That's one of the most used ones, is what we call social support. Yes?
Analyze my situation and I come into terms with it and say to myself, get over it.
Get over it. You kind of scare yourself out. Before we go that, I like to, sorry, wrong way. If you do this, these are the negative styles, and it doesn't do. Maybe for the time being, it seems to help, but in the long term, it doesn't help. So what we are talking about is like getting information about what we lived and sharing emotions and thoughts, go back to regular sleep, exercise, take part in recovery actions.
Show the negative styles again.
Negative ones? Which one are we doing? Okay. All right. So this is that sometimes accept what we have to go through is normal and try to go back to regular routine. This is how we look at the coping channels. Everybody's different in terms of coping, because somebody likes to talk about to friends and families, somebody else likes to pray, somebody else might be good, just takes a walk. In terms of cognitive ways, like you were describing, you evaluate again, you kind of think about it, and you come up with different ways of thinking. That's what we call the thought channel. The affection channel is we cry, we talk to other people, we get the emotions out. Social interaction is what we call social support. Belief is usually our way of praying and getting over the event. Imaginary tactics are usually we use in terms of how to treat the depression or other symptoms, that we have the person concentrate on more positive images when he or she is supposed to be counteracting with the negative events. And the physical things, of course, exercises and whatever. Let's go quickly. For children, we like to have, I always say, adults should take care of themselves first. Why do I say that? Because in Turkish culture, all the mothers say, I am doing everything to make my child happy. I said, don't do it. Just make yourself happy first. Why do I say that? So the kids are more sensitive. When they see the parents are, not stable, they are more affected. But if they see the parents as stable and normalized, they will recover quickly. The kids will be harmed probably quickly, or they will be affected quickly, but they are the ones who also survived quickly. That's why when I arrive, the first thing I worry about the interventions with the kids. After I set it up, then I work with the adults. And usually I have the adults working for the kids too. So we do have different way of working with the kids. These are from Mardin. In Mardin, we didn't only work with the families of people who were killed, but we also work with the families of people who killed the other part, because they were also affected. These are some drawings from them. Coping strategies for young people, we usually have them go back to their routine, and what is more effective is that helping other people. Like the students, we have been working with different universities and colleges after Ankara bombings, they didn't even need a second session, because now they are working with the children in different activities. And last night we had the session, all of them looked better than I did. So they survived and they are doing good work. This is what we say: talk to friends and family, get back to sleeping patterns, normal life. Stay away from drinking and smoking if possible. and medication only if it's prescribed by the doctors. And what helps is that helping others usually. That's why most of the time, instead of getting 100 psychologists over there, which we do in the beginning, I try to work with people who are from the community who are affected. So usually people say, nope, I lost my family, I lost my house, I'm not going to do. But we usually get them involved because that's how they can recover. And what happens? What we are saying usually, if anything happens and you have to deal with people who are traumatized in your close circle, please do not say, I understand how you feel. Because we do not really understand how they feel. But it's enough to be there and just do some activities with them. Because every individual is different and unique. And don't force them to talk. Do not force them to tell you all about what happened over and over again, because it's just more traumatizing. Unless you're a professional, you should not do that. And I always say, don't say these words. Don't worry, don't cry, it could be worse. You're strong, you can beat this. Why is it? This is all probably have been doing. Why am I saying don't do this? Exactly. And if person is crying, let them cry, because it helps them to feel better. If you say don't worry, let them worry, because they have to worry. And if you say don't cry, you're strong, you can handle this. And I don't feel strong, but someone is telling me, no, be strong, you have to be strong. So it's like being there is enough. Don't think about the event, or as soon as person starts talking about it, say, let's change the subject. It's not also a good idea. This is from the bombing in Reyhanlı, I think, with the other. I know the time is coming, and some of us have to go, right? But what I would really like you to do, go in and check this thing called post-traumatic growth, because anybody who is able to cope with the traumatic experience has a growth. It's like the more we cope with the traumatic experience, the stronger we become. So when we look at the persons, communities, people or groups, the ones who have experienced traumatic experiences and cope with it effectively, they are stronger than before in that sense. And these are some things. And this is the one I like, and which I discovered lately. Thank you very much.